All right, of course, it's the holiday season. There's a lots of fun stuff, good stuff that occurs, family time, friend time, time away from work. But it's also something that occurs during this time of the year that a lot of people may not be aware of. I certainly wasn't. There's something called seasonal affective disorder, or SAD, SAD, as the acronym. Many Americans are inflicted by seasonal affective disorder, SAD. So, what is it? How do you know if someone has it, and what can be done to help someone, a loved one who has it? Joining us at this time, as he often has, is adult primary care physician and the director of the Body and Mind Medical Center in Chicago, Dr. Dominic Gaziano. Dr. Dominic, good to have you with us.
Thanks, Rick. Thanks for having me.
So,
So,
yeah, what is seasonal affective disorder?
well, it is actually a type of depression. And how does it differ? Depression occurs at any time during the year, but this occurs specific times in the year, mostly fall and winter when light and light kind of comes down. A lot of my friends that love to hang out in Florida and they're working in the Northeast or Midwest and other warmer climates in Asia or Africa. They actually they call it refrigerator weather in Chicago. So what is refrigerator weather? So my African friends say the light is shining outside and it's supposed to be warm because that's the way it is in Africa. But in the refrigerator, the light's on and it's cold. So in Chicago, we have sunny days and it's cold. But also, the more important thing is the amount of daylight that comes in and affects our different parts of our brain that sense these things. We go in cycles. So the fall and the winter, once the daylight hours are shorter and affect people with seasonal affective disorder. Again, it's a type of depression. And so the symptoms really are persistent low mood or sadness. They may be just more fatigued or decreased energy. A lot of patients ask, Doc, I need to have more energy. And I tell them all the ways to do it holistically, like try to get some sound street sleep, try to get some exercise, eat right, to get more energy. You don't need Red Bull. It gives you wings. No, we can do other natural things. But during this time, they have this a little bit more weakness and changes in sleep pattern. They have difficulty concentrating. Sometimes feelings of hopelessness. Um, so that's a SAD or seasonal affective disorder.
And does the time change uh, contribute to that?
Yes. So they've even talked about daylight savings time is not really good for some of these disorders. But we can cycle through that. But it does, I think that when we lose daylight savings time, for example, in my neck of the woods, we're getting toward the end of December. It's December 12 right now. December 21st is the shortest day of the year, the winter solstice. We have the shortest day. It's about 3:40, and we lose about a minute of sunshine every day on the sunset, and then in the morning a minute as well. So it affects that less sunlight, especially in the evening. You're still at work and it's dark outside, and then in the southern parts it's a little less pronounced. It might be 4:30 or 5 in Florida, perhaps based on where we are geographically. So we're getting less daylight definitely during these times, and and people say it's really sad. It's dark outside when I'm going home from work.
Yeah. Yeah. Uh, so how do you diagnose someone with SAD? And how do you
Yeah.
know if a person may have it themselves?
Yes. Okay. So let's talk about the potential causes, and then I'll talk about the diagnosis. And
Yeah.
the causes really sometimes it can be a family history of depression or SAD, seasonal affective disorder. It can be genetically if you have your parents or some of your siblings have this, you might want to get checked out. There's imbalances in neurotransmitters and things, and serotonin, melatonin, things. And basically the lack of sunlight exposure in these areas. And our body has a circadian rhythm that's kind of off because of these things. And some people are just more affected by this circadian rhythm. The cortisols peak and they nadir at different times.
It's my
So,
if I can interject,
yeah,
it's my understanding that if you go out and look at the blue sky or the sun in your on the side of your eye, that helps adjust your cortisol levels. Is that accurate?
I've not been heard of that. And that's possible. I just haven't heard of that.
Okay.
And I, I, um, I think that just as far as the cortisol levels, they kind of run on your own. It's hard to adjust that. Then they're more to the light, going on and off during the day, and they're going to nadir it. They're going to go low at a certain time of day where you might be a little weaker. Usually, sometimes around two p.m. and maybe highest around eight a.m., 7 a.m. Um, so the diagnosis of seasonal affective disorder is the DSM-5, which is the psychiatry book. It's like a big, thick book that that psychiatrists use to diagnose different psychiatric disorders. It says the presence of a depressive episode occurring in a recurring pattern over 2 consecutive years. So it has to occur over 2 years, the
Hmm.
cycle. We could have just had a bad cycle one year. And uh, and the absence of the non-seasonal depressors during the same time period. So, and they associated with this is social or occupational difficulties. We always think it's a problem. When do we need to see a psychiatrist or a psychologist? When those two things mainly, you have social dysfunction significant, or your work is suffering, from this issue, then we definitely need a referral. Primary care doctors deal with this too, or psychiatrists or psychologists or counselors.
Wow. You know, I get a mental high
Hmm.
when my blood circulates, whether it be from stretching, which I do a lot of body stretching,
Sure.
whether it be from going for a run, a walk outdoors. Outdoors is the key here.
Yeah. Oh, yeah. Nature heals. Awesome. Yes, I agree. So keep that up. So, there are endorphins that you get from different types of exercise. Now,
Endorphins, yeah.
and Americans don't want to hear this, but they always try to be honest, the yoga movement's wonderful, but it's good for flexibility and focus, but it may not get you to the cardio what you're talking about, vigorous cardio, unless it's a vigorous cardio yoga. So other things will get you that high, like a vigorous run, bike ride, vigorous swim, where
Yeah.
you do cardio. So this is what the moderate intensity exercise, getting your heart rate, depending on your age, around 110 beats, 100 to 110. But your heart beats around 140, 130, and most of my patients do that. They're in the vigorous category. We need less for our general health, but there's that high that you have that you actually. The way I look at it, in my run when I'm really working and I may want to try to beat that person on the track that they don't know that I'm trying to race that. But anyway, I want to try to really push it. I can't think of anything else. I can't think of work. So there is a catharsis that I get, and a lot of my patients get with exercise,
Yeah.
and that endorphin boost, occurs as well. The runner's high you hear about is real, and I think that's about the way I tackle the winter. I do the exercise, and there's light therapy also that you can use, and different modalities you can talk to your primary care doctor about. Um, so those are some of the things that can kind of help this matter, and CBT or talk therapy to talk about those kind of things that bug you, maybe a friend problem, a work problem. They get multiplied a little bit more, and they become obsessive. So to have a sounding board, a friend can do talk therapy. A primary care doctor can help with talk therapy to kind of just bring those things to the surface so they don't fester, and they become more significant problems that you can work through during this period where you sort of have a wounded perception when you have any, well, like a mental health disorder like depression or seasonal affective disorder, major depression, or I always call it's a wounded perception. You don't realize how down you are and things are magnified. So to talk it out, and do exercise and get out. Yes, nature heals. there've been studies looking out the window at trees does better than looking out the window at buildings. Surgical patients,
I'm
there's been
sure.
studies. Yeah.
I'm not a, you know, I feel bad for people in New York City. Let's just put it that way.
Well, yeah. Well, they got their green spaces and they're trying. I think they're trying to do it on buildings. And I was in Miami. They have palm trees and brickle, like in these little greens. It's kind of cool. They try to build new buildings and high rises with little green spaces on the roof deck
Oh,
too.
wow.
Yeah. So
Well, that's great. Are there any programs people can turn to who may have this disorder?
there's the National Alliance on Mental Illness and NAMI, National Alliance on Mental Illness, and the website is NAMI.org, NAMI.org. And then the Mental Health America, and that's MAH are a few sites, and those are good references, and there's 800 numbers with both of those.
Great, great. Listen, Dr. Dominic Gaziano, it's unfortunate, but it's a timely topic. It's an important topic,
Thank you.
and really appreciate you joining us and sharing your insight and expertise on this important topic. Any final comments?
Yeah, I think as the day is getting shorter, we're in toward December, right? And I think it is good to try to just keep moving and try to get on a schedule. One thing that I want to say, a sleep wake cycle that you get up and you do. There's things that you can win your day. People who have seasonal affective disorder, there might be 3 or 4 things they do at their home, as routine to make them feel better and accomplished in the morning, like watering the plants, making the coffee, making the bed. Some things you call you win your day, that you do routines that you get up a certain hour and maybe make a phone call to a friend to talk about some of these things that are a little more heavy on your mind as well.
Wonderful, wonderful. We thank you for joining us.
Thank you, Rick. Thank you for having me.
There's Dr. Dominic Gaziano talking about an important topic, the seasonal affective disorder, or SAD as the acronym. Back with more after this.